Hey there! So, I've had a request to have a discussion about peripheral vascular disease. And I was so excited to have a request. So, I threw this together. So, today we're just going to talk about an overview of peripheral vascular disease. And the first thing we're going to do is we're going to hit on a definition. And peripheral vascular disease really is an umbrella term. It's related to all vessels of the periphery, including arteries, veins, and the lymph system. And that's really important because sometimes we hear about peripheral artery disease instead of peripheral vascular disease. And really, peripheral artery disease is one of the vascular diseases. And we're talking about, just to be clear, that it's peripheral. It's out in the periphery, so arms, legs, neck, and or the face, actually. All right, umbrella term, peripheral vascular disease. One type of peripheral vascular disease, excuse me, is venous insufficiency. Then, as I already said, is peripheral artery disease, and another is lymphedema. So when we talk about venous insufficiency, we're talking about things like varicose veins, aneurysms in the venous system, thrombosis, blood clots, and deep vein thrombosis, which is really important. Then we're talking about blood clots that are in the deep veins, and these are the really dangerous ones. You get little clots out on the surface, not such a big deal. It's not likely to go anywhere unless it grows and becomes a bigger problem. And then it can actually lead to deep vein thrombosis, or it can travel. And where is it most likely going to get stuck? Yes, in the lungs. You want to remember that. DVT goes to the lungs. And so when we talk about venous insufficiency and what does that look like, here's a picture. So this person has these really awesome varicose veins, lots of aneurysms in the system, probably has some connective tissue disorder as well, which leads to this. And this is not that big of a deal. So the veins are really big. What you worry about is if this gets pinched off, this is really prone to be a place where peripheral superficial clots could develop because blood might just be sitting there and pooling, and it's not actually getting back to the heart, staying active in the circulatory system. So you worry about little clots out here. A lot of people, especially women, are more concerned about how does this look. Who wants to wear a pair of shorts when your legs look like this? It's going to stand out, and someone might be like, you know, it looks like I have worms in my legs. Of course, they don't, but that could be their concern. Okay, cool. All right, again, venous insufficiency. We're talking about varicose veins and aneurysms. These are low pressure system, so it's not like this is an aneurysm that's going to burst. Just keep in mind that they're just pouches that are going on out there. Could lead to thrombosis, and especially we worry about deep vein thrombosis. All right, peripheral arterial disease or peripheral artery disease. Here we're talking PAD. Now we're talking about atherosclerosis. This is a much bigger deal. Now we have a buildup of plaque in the arteries, just like we can have around the heart. And so the concern is if one of those plaques breaks free, you now have an artery that is occluded, or it can build up with a clot as well. Most likely it's going to be a breaking free of the plaque. And now you're going to have an area of tissue that is not getting an oxygenated blood supply. This is going to lead to infection. It'll lead to wounds because you're going to have a little part of the vessel or a little part of the tissue there that's dead. It's not getting oxygen. It's dying off. It's dead. That's going to turn into a wound. And then it has a high likelihood of infection. And we really worry about gangrene because we're talking about tissue that's getting no oxygen. And so when the infection sets in there, gangrene, if you recall, is an anaerobic infection, and it's going to just continue to go and go and go because there's no healthy blood coming in to destroy the bacteria and get rid of the infection. Another picture there. So over here on the right hand side, pretty mild peripheral artery disease. You're not getting good supply down here. The tissues look sad and not very healthy. But over here on the left hand side, this person's right foot looks really bad. And now we have a pretty big section here where there is no blood supply to the end of that toe. It's dead, it's dying, it's sloughing off. And then looking up the toe into the foot, you can see where some of that tissue is sloughing off as well. That is going to be concerning for a gangrenous toe and possibly into a gangrenous foot. When they go to take that, they're going to have a lot of issues, a lot of concerns about how far up to go. And this actually could turn into a below-the-knee amputation if they can't get ahead of it. They're going to aim for lots of antibiotics, opening up some of that vasculature, and maybe taking off the toe only, or maybe doing a midfoot. But there's a really good chance of amputation and because of gangrene on this foot. So now we're talking about peripheral artery disease, just to review. All right, the other one in peripheral vascular diseases is lymphedema. And here is where I want to really emphasize again, we're talking peripheral. This could be in the face, the neck, the arms, and the legs. The idea is that lymph vessels are becoming blocked. Either they've been cut after a mastectomy, or they've been damaged after trauma of some sort, or they're blocked up with goo and you can't clean it out. But the fluid cannot be drained from the tissues. And so you just have a buildup of fluid that's stuck out there in the tissues. The scary thing with this is also the immune cells cannot be dropped off into the tissues, which makes these patients prone to infection as well. But this is more like weeping wounds, lots of swelling. They weep, they don't do well, they scratch because it itches and it doesn't feel good, it's stretched. They get a staph infection that builds up in there, and then poof, they have cellulitis because it's really hard to get ahead of this because we can't get the immune cells into those tissues. Like I said, it can happen in the arms. This is most likely over here on the right-hand side. And the right arm, it's most likely post-mastectomy, although that's not necessarily true. It could happen for a number of reasons. It could just be that they removed a bunch of lymph nodes because there was some concern for cancer. And now you have the lymph edema in that right arm. And then over here on the left side, those are some awesomely swollen legs that don't look very healthy at all. And they're struggling with lymphedema. Now, this patient may also have some arterial disease. I don't know for sure, but definitely some lymphedema in both legs. So it could be one leg, both legs, hard to say. All right, just a quick review of lymphedema there. Back to the basics. And that's my quick, less than 9-minute presentation on peripheral vascular diseases.